So let me ask you, which one of is the ampullary end? Is this the ampullary end, or this is the ampullary end? Well, if you say this is the ampullary end, you are correct, because this ampullary end, anterior ampullary end, is going to combine with the lateral ampullary end of the lateral semicircular canal and form the vestibule. And here is the internal acoustic meter. Some of it has been discussed and dissected. And here you see the labyrinth part of the facial nerve will be right about here. And this is the petrous apex. Let me show you another perspective of this particular dissection. Now we are looking from medial to lateral. And you see this superior semicircular canal. It is lower than the tegment tympani. And what you see, this is the ampullary end. This is the non-ampullary end. And this canal that you see here, which has been dissected out, is the subaqueous canal, which transmits the arcuate artery, which is a branch of the labyrinth artery, which is the direct connection of the middle cranial of the posterior cranial fossa with the middle cranial fossa, and any infection in the masculine air cells may pass on to the posterior cranial fossa. So what else? We also see the carotid canal here. This is the sigmoid sinus going inferiorly here. So let me go on to the next cut here. And here we have an end on looking from above. You can now see this was the superior semicircular canal. This is a posterior semicircular canal, and this is a lateral semicircular canal. Now, it's very important to remember the relationship of the posterior semicircular canal with the vestibular aqueduct or the endolymphatic sac. It is always inferior and runs almost parallel. And this is what you'll see on the CT scan to the posterior semicircular canal. So this is the superior semicircular canal. This is the ampullary end of the, which is going to be the ampullary end of the posterior semicircular canal. This is the non-ampullary end. So the non-ampullary end of the posterior semicircular canal and the non-ampullary end of the superior semicircular canal will together form the crus commune. You are aware of that. And what we see here is a lateral semicircular canal, which has its own, the non-ampullary end will actually open into the vestibule by a separate opening, but it combines with the ampullary end of the lateral semicircular canal, combines with the ampullary end of the superior semicircular canal, and forms the vestibule. Coming more anteriorly here, the vestibular, like I mentioned earlier, the vestibular aqueduct or the endolymphatic sac should be somewhere here. But if you come more anteriorly here, you see this little opening here. That is the cochlear aqueduct. The location of the cochlea is like here, and the location of the cochlear duct is always inferior and almost parallel to the internal acoustic meatus. Just like the location, how do you identify the vestibular or the endolymphatic sac on the CT scan? It will be inferior and almost parallel with the posterior semicircular canal. Similarly, the cochlear aqueduct will be almost parallel to the internal acoustic meatus. Now, if you're wondering what is this yellow colored arrow here pointing out to this probe actually has been passed from the round window, and you can see it appearing at the apical turn of the cochlea. So this is where the cochlea is located. Now, if you look at the relationship of the labyrinth part of the facial nerve, which is right about here, that the cochlea is just in front of him. A very close relationship, which you will be able to appreciate on the CT scan. The rest of it is petrous part of the temporal bone. Sometimes it may be pneumatized, that you see here. Some of the cells here are pneumatized. But what about this canal right here? So previous. No, you'll see it in the next slide here. So this is the, again, view from above. You can see the horizontal crest very nicely. This is the horizontal crest. This would be the labyrinth part of the facial nerve. The genital ganglion will be here. The facial nerve will turn posteriorly here, going towards the mastoid. And this groove that you see here is that for the greater superficial petrosal nerve that Satish was talking on, which would come anteriorly, collect fibers from the carotid artery, parasympathetic fiber, and continue as the ovidian nerve. And this is the probe again that I mentioned earlier, which is has been passed from the round window. I'll show that to you later. And this is emerging here from the apex of the apical turn of the cochlea. So this is the horizontal crest or the transverse crest, as we call it. Facial nerve above, And what is going to be below this is the cochlear nerve. We don't see the SPM, we don't see the inferior cochlear nerve, we see that later. Okay, so again, this is another view which is showing you the end-on view of the cochlea, and you can see the modulus inside the cochlea. You have a beautiful view of the internal acoustic meters, again, the transverse crest, and maybe you can see a little bit of the Bill's bar or the the vertical crest here, and that is the superior semicircular canal. And what else? This is the carotid, and this is the groove for the GSPN, or the greater superficial petrosal nerve. Now, if you look at the inferior surface, I think most of you can appreciate this is the styloid process, and that is a styloid process. So this is going to be the styloid mastoid foramen through which the facial nerve emerges. This is the mastoid process. We have four muscles attached to the mastoid here. They are the sternocleidomastoid and the posterior belly of the digastric, splenius capitis, and the longissimus capitis. And coming here, this is the jugular foramen right here, and that's the carotid canal. We'll talk about the relationship on the CT scan. Now, do you actually happen to see this little probe that is pointed with the arrow? This probe is going through the inferior carotid canalicus, and it will emerge onto the promontory or into the middle ear and go onto the promontory to become the Jacobson nerve, or the tympanic branch of the glossopharyngeal nerve. So that later. So this is basically, now you see the temporal bone has been split open, and we are now right through the middle ear with such accuracy that I cannot imagine. So you have, this is the lateral wall of the middle ear, and this is the medial wall of the middle ear. On the lateral wall, you can see the tympanic membrane, you can see the ossicle, and you can see the incus, the short process of the incus, long process of incus, the head of the malleus, and the long process, and this is here, what you see here is the eustachian tube, and there is a canal for the tensor tympani muscle, and so you see a beautiful demonstration that was the anatomy. The superior limit of the middle ear is the tegmen, as you see superiorly, and the inferior limit is the jugular fossa here. Now, very quickly, let's look at the medial wall of the middle ear, and you see the promontory right here, and this is the probe that I showed you earlier, coming from the carotid canalicus, and you see this coming out here, passing on to the promontory. It is gathering some fibers from the carotidotympanic fibers, and is going up and is becoming the lateral superficial petrosal nerve. Note that the groove for the greater superficial petrosal nerve is superior to the lesser superficial petrosal nerve. No wonder this is called great and this is called lesser, because it's more inferior. Now, also very beautifully, you see the promontory here, which is formed by the basal turn of the cochlea. And here you see the old window, the stapes has been removed, and see a beautiful, this is where the genital ganglion would have been, had the facial nerve not been removed. And you see a beautiful, the entire canal, fallopian canal, coming down here and emerging here as the at the stylomastoid foramen. And what is this compact bone here? This is the horizontal or the lateral semicircular canal. So you see beautifully the relationship of the lateral semicircular canal, the facial nerve, oval window, the promontory, the round window right here, this probe that I showed you earlier has been passed from the round window here, and you saw it emerging from the apical turn of the cochlea. So all these structures will be, and very nicely on this particular cut, you can see the carotid canal in its entirety. You see here is entering, and this is exactly how you see it on the CT scan. It is entering the petrous carotid canal and emerging here at the petro-occipital suture, and to become the to go into the sphenoid as the paraclival carotid artery. So let me go on to the next. So with that brief introduction, I'm going to go to a few specifics here. So basically, let's look at the anterior surface of the temporal bone, petrous temporal bone, which is related to the middle cranial fossa, And here is a beautiful demonstration how we're going. Let's start. I think there's always, you must always look at all these pictures very systematically, because there's too much information in these in these slides, so you can miss them. So I always start from Petrus apex, and here we see what is this ligament we are talking about it just now. This is the petroclinal ligament. This is and you can see the sixth nerve piercing, emerging from the Doralus canal and passing here behind the first part, the V1. The V1 is the ophthalmic nerve. So actually, to see this nerve, you'll have to retract the first part of the V1. And here, this is the foramen rotundum. We are talking about what is the maxillary strut. This is the maxillary strut right here, which separates the V2 from the superior orbital fissure, which is right here. This is the maxillary strut, and this is the V2, and this is the foramen ovale, and through which the mandibular nerve is passing inferiorly into the infratemporal fossa. And this little thing is the foramen spinosum. There was a lot of talk about the GSPN, and this is the GSPN right here, passing over the carotid artery just below the V2. So there is a depression on the temporal bone here, which you will appreciate on the CT scan. That is called the trigeminal depression, which houses the Meckel's cave. And then there is a relative, I would call it a relative eminence, which is called the trigeminal eminence right here. And again, then you'll see another depression, which is called the meatal depression. And then again, another elevation, which is called the arcuate eminence. So it starts with the depression, elevation, depression, elevation. And then the rest of is the tegment tympani. The external ear canal will be here, and the middle ear will be here, and the rest of which is the mastoid. So I hope that sort of orientates you to what we're seeing here. Now, the foramen ovale and the foramen spinosum are very consistent landmarks on the CT scan and can always be easily appreciated and recognized. Now, so the internal acoustic meatus has been opened here, and what you can appreciate here that the porous end, this end of the IAM is called the porous, whereas this is called the fundus, is much wider than the porous. So what you see here is the facial nerve, and the cochlear nerve will be below this right here. I think that would be we don't see the cochlear nerve very well, and this is the horizontal crest that you see here is the genital ganglion. And that is the facial nerve, and you see the GSPN right here. So what is at the angle between the labyrinth part of the facial nerve and the GSPN? What lies in this little triangle here? Anyone? What is this? And what is this? Is this the cochlea or this is the cochlea? Well, if you think this is the cochlea, you're wrong. And if you think this is the cochlea, you're absolutely right. The cochlea lies here, and it's a very close relationship with the GSPN and the labyrinth part of the. Another way to remember that the cochlea is here, because the cochlea is always anterior to the IAM. It's always anterior, never behind or posterior. So this is where we're going to find the apical turn of the cochlea. We talked about the foramen ovale and the V2 right here. Here you see the epitympanum a little bit. You can see the what we call it the ice cream cone configuration that you will see on the CT scan, and you will see a little bit of the middle ear here, and this is the external auditory canal, and this is the mastoid. You also see here is the superior semicircular canal right here is a lateral semicircular canal, and you see how beautifully you can see the posterior semicircular canal, which is almost hugging, going below the lateral semicircular canal, and its ampullary end will open into the vestibule. Again, just to recollect that the ampullary end of the superior semicircular canal is here, the ampullary end of the lateral semicircular canal here. So this is here where the vestibule is going to be, and that is why this is the superior vestibular nerve, which will go into the. And what is this A here? This is going to be the eustachian tube, is going to be here, or that's the foramen spinosum. So exactly here, this is to show you the relationship of the apical turn of the cochlea, how closely it is related to the labyrinth part of the cochlea of the facial nerve and the GSPN. This is where it's going to be. Very important for neurosurgeon to be drilling at the right spot, not to injure the into the cochlea. Now, if you can remember this image, in fact, imprinted in your mind, because it's very important for the CT correlation. Here you can see again, this is the IEM. I already talked about it. You see the cochlea right here. You see the GSPN. But what is this structure coming here, right here, and ending here with the tendon here? That is the canal of the tensor tympani. Very commonly asked, where does the tensor tympani get its blood supply from? Well, the nearest source is the middle meningeal artery. So naturally, it will get its blood supply from the middle meningeal artery. Where does it get its nerve supply from? Well, the nearest source is the promenavalis, which is get it from the motor branch of the mandibular nerve. Most of the times is the, if I remember correctly, is from the nerve to the medial pterygoid, also supplies the medial pterygoid muscle. So you have a nice, very nice view of the tensor tympani right here. And what you want to note is that look at, this is where the processus cochlear-formis is going to be. And the tympanic part of the facial nerve is that this is a landmark of where the genital ganglion ends and the tympanic part of the facial nerve starts, below the of the lateral semicircular canal. Again, you have a nice view of the inferior joint, and this arrow points to the tendon of the tensor tympani. And anyone, what nerve is this? Actually, even I don't know, but I'm guessing is the lesser superficial petrosal nerve, which is lower than the greater superficial petrosal nerve. And most of the time, it can actually exit through the foramen spinosum or anywhere through the petroclival fissure. Now here the carotid artery has been removed, and you can see the entire length of the tensor tympani, and this is the tendon here. And again, a beautiful view of the IAM and GSPN, the 11th part of the petrosal nerve of the facial nerve. This is the cochlea, and this is the Bill's bar, the vertical crest. We talked about the horizontal crest earlier, and this is the vestibule. This is right here, the vestibule formed by the ampullary end of the superior semicircular canal and the ampullary end of the lateral semicircular canal. Now, out here is the posterior semicircular canal, and this is the crus commune formed by the non-ampullary ends of the superior semicircular and the non-ampullary end of the posterior semicircular canal. And this is the ampullary end, which is going inferior